Hello, and welcome to another episode of the Journey to Motherhood podcast. In this episode, I want to discuss the different types of providers that you might run into on your journey to motherhood. When we are going through our motherhood journey, whether it's preconception, pregnancy, or all the way through the postpartum period, there are many different types of healthcare providers that we may or may not run into. Sometimes we'll run into all the types right away in our very first pregnancies, and sometimes we won't meet them until even our fifth babies. So I think first-time moms and even moms of many will find this episode beneficial. First things first, we should talk about preconception. So women decide that they want to have a baby, and some of them just go for it, and that's great. That's one way to approach parenthood. Another way is to have what they call preconception counseling with a trusted healthcare provider. Typically, when somebody who wants to have preconception counseling wants to have a baby, they'll do so within a year of having the baby. And during this appointment, you're going to talk about your family history, your risk factors, medical conditions, your lifestyle, and so on. The idea behind this type of appointment is to try to keep you and your baby as healthy as possible and reduce the risk of possible pregnancy complications. I will say, though, that statistically speaking, they say that nearly half of all pregnancies are unplanned. So, this isn't even a super common appointment that people seek. So, if you decided to have a baby and didn't have an appointment like this, there's no shame in that. It's completely fine and it's actually pretty normal. If you do decide to schedule one of these appointments, you can expect some exams, like a physical exam, where your provider might check your vital signs, like your blood pressure, and they may ask to perform a pelvic exam. They'll order lab work, like blood work, so you can be checked for signs of infections, diseases, or any conditions that you might need treated. Another thing they can look for with this blood work is genetic tests that can detect conditions that your baby might inherit from you or even your partner, so you guys can be prepared in those situations. So, yes, they'll do blood work for your partner as well. They're also going to ask you questions about your family history. And again, this is for a similar reason. They're looking to see if there's any genetic conditions that you might pass on to baby that we might need to be aware of ahead of time. They're also going to talk to you about the best time to conceive each month, which is when ovulation happens. They can give you as much or as little information about that as you want. A lot of women don't really understand their bodies and how they work because we aren't really taught that in school. I know that in school, a lot of people say, hey, have sex and you can get pregnant, but nobody mentions ovulation and your body and how it actually works. We could do a whole separate episode on that. It's actually super interesting. So your provider can go over that with you in the preconception counseling appointment. Another thing that you can expect at this appointment is discussing vaccinations. Some women prefer to vaccinate, some do not. I know that this is a hot button topic, but I am not going to tread carefully here because, in all honesty, I think my viewpoint is the correct one to hold. But although I believe most people believe that, but anyway, essentially, I think that women should be provided with all the informations, the pros, the cons on both sides from an unbiased point of view so they can make an informed and empowered decision for themselves. I believe in truly informed consent so each mom can make the decision that is best for her and her family. So some of the vaccines they'll discuss are vaccines that you might get in pregnancy should you decide to go the vaccination route, things like the Tdap vaccine or the flu vaccine. You can also talk to your provider about immunizations for your baby during that appointment as well, if that's something you're looking to do. Again, ask all the questions and make educated decisions rather than just listening to what some lady on a podcast or some Facebook post or whatever says. Just my thoughts. They're also going to talk to you about medications that you take and diet, exercise, and your weight. I know that this is a touchy subject for some people, but I do believe that this is an important discussion to be had. Your lifestyle is going to affect your body, and therefore it's going to affect your baby's growing body as well. So, discussing the benefits of diet and exercise before, during, and after pregnancy, it really is an important discussion that you're going to need to have. So they're also going to talk about some foods that you might need to avoid. They're going to suggest avoiding things like fish that contain high levels of mercury. They're going to talk to you about exercises. Well, exercises are safe during pregnancy as well. And yes, you should continue to exercise while pregnant, unless your doctor says otherwise. I kind of think of labor as like a marathon. You don't just show up to a marathon and expect to be able to run it, right? You have to train for that. So do the same thing for labor, exercise during your pregnancy if your provider says to. I think that pretty much covers most of what you'll talk about during a preconception appointment if you decide to have one. So now you're pregnant. Congratulations. We're going to move on to the pregnancy side of things, and there's going to be a few different types of doctors or providers you might run into during your pregnancy. I specifically want to talk with you about midwives and obstetricians or OBs for if you're having a low risk pregnancy. If you are having a high risk pregnancy, maybe you have a condition or your baby has a condition that needs to be monitored, you might see a different type of doctor called an MFN or a maternal fetal medicine doctor. Um, in a typical situation, though, you're going to set up an appointment, and by typical, I mean low risk. You're going to set up an appointment with the obstetrician or a midwife. More than 90% of women opt for an OBGYN, the obstetrician, for their pregnancy. So we're going to start with talking about them. This OB is a trained doctor for every aspect of pregnancy, including preconception, prenatal care, postnatal care, and general women's care. A lot of women will see a specific OBGYN for their healthcare prior to pregnancy. And once they become pregnant, they'll have already established a working relationship with their OBGYN, which is why most women will stick with an OB for the pregnancy and delivery, just because it's somebody that they know, they trust, they're familiar with. OBs are more likely to use surgical or technological interventions during labor and delivery, which is something you do want to keep in mind when you're deciding what type of provider you want to have. During your pregnancy, you're going to go in for routine prenatal care checkups with your OB. These appointments are usually short, quick, and to the point. They usually have you in a 15-minute time slot in their calendars because they see a lot of patients. It's more of a numbers game. It's much less personalized care. When you go in for a visit with an OB, you'll spend time first with a nurse who's going to weigh you, take your blood pressure. They'll get a urine sample from you if it's required for that particular visit. And they'll ask you if you have any questions for your doctor and things like that. When the OB does come in, typically they're going to listen to your baby's heart rate. They're going to check the position of the baby if you're far enough along. They're going to look for swelling. They'll measure your belly. They'll answer any of those questions that you had left with the nurse previously. Sometimes visits can look a little bit different though, such as when you're scheduled for an ultrasound or you need to do the glucose test. How those things work really depend on your provider. In my area, they will typically schedule an ultrasound for before your OB visit, and then your OB will look over your ultrasound during that 15-minute visit you're with them and let you know if there are any problems that need to be addressed. During the glucose test, you typically go into a lab setting. You're going to drink a glucola drink, wait an hour, have blood work done, and see if you need to repeat the same exam during a 3-hour period to rule out gestational diabetes. So that's kind of OBs in a nutshell. We're going to move on to a midwife. A midwife is another type of healthcare provider that you have the option of seeing. Within midwives, there are actually different types of midwives. There's a CNM, which is a certified nurse midwife. These are nurses who have completed a midwifery program and passed a certification exam to become a midwife after having already become a nurse. There's also direct entry midwives or certified professional midwives, CPMs. These midwives are trained in midwifery without a nursing degree. So they learn through a variety of routes from school, apprenticeship, or even a college program that's separate from nursing. A CPM typically has more experience delivering babies at home or at birth centers. Currently, they are only licensed in 34 states, though, whereas a certified nurse midwife is licensed in all 50 states. I imagine this could change in the future, but right now that's where we're at for midwifery. So typically, midwife, when you are in labor, they're going to approach it in a more natural way than an OB, in that they'll encourage breathing techniques or hydrotherapy, for example, to get you through labor rather than saying, hey, let's go get an epidural. They're also more likely to offer nutritional and breastfeeding support before, during, and after pregnancy. CNMs can also work at the hospital, a birth center, or do home births. In some settings, they can provide labor-inducing medications or even prescribe epidurals like an OB can. If having a vaginal birth is your number one priority, I would recommend trying to find a midwife, as they tend to have lower cesarean delivery rates compared to an OB. An appointment with a midwife is similar to an OB in that you'll go through the same things I previously talked about, but it's much more in depth. They're going to walk you through anything and everything you could need to know. They're going to answer your questions more in depth because they truly have the time to do so. An appointment with a midwife typically takes around an hour because they're not playing the numbers game. They see much fewer patients than an OB is going to see. They're going to work with you in addressing your fears, how to cope with labor pains, how your partner can help with labor, and so on. They're much more personal because you have that time. So these are some of the professionals with the title of midwife. Um, Outside of these midwives, there are also something that the birthing community tends to refer to as medwives, M-E-D, medwives instead of midwives, because they don't go the more natural route of pregnancy and delivery like a midwife normally would. So if you want to have a true midwife, I suggest making sure you do some research on them and make sure it's actually a midwife, if that's the type of provider you're looking for. So make sure to ask lots of questions. I kind of want to put a little aside here. If you want a natural birth instead of a C-section, you want to make sure that the provider you're choosing is actually supportive of that. A lot of providers will say, yeah, I'm totally supportive of that. They're truly not. Uh, So let's talk about that for a second. So there's some red flags that you should look out for. So a provider saying that you must go into labor by 40 weeks or 41 weeks. You must only gain a certain amount of weight during your pregnancy, or that a baby must weigh under a certain amount determined by an ultrasound. They also want your cervix to progress in labor X amount of centimeters per hour, or they expect a labor that isn't long in length, or a provider who puts you on a time clock after your water breaks. On the flip side of that, there are some green flags that you can look for in a provider to make sure you're getting the type of provider that you want. So you want to find a provider that doesn't have arbitrary restrictions on length of gestation or labor and will let you labor as long as mom and baby are doing well. There will be no weight guessing for baby based on ultrasound. You're only going to be induced if truly medically necessary. And they encourage laboring outside the hospital as long as possible to prevent interventions. These are all good signs, green flags of a provider who's really going to help you achieve a vaginal birth versus the red flags that I mentioned. It's also good to look into their C-section versus their vaginal birth rates. You'll find that OBs will probably have 30, 40, 50% C-section rates, which are really high numbers. And midwives are going to have significantly lower. But again, look for a midwife, not a medwife, in order to meet that criteria that you're looking for. So now once you've decided on a provider, you want to schedule your first prenatal visit once you get your positive pregnancy test. This appointment typically happens in the first trimester, somewhere between 8 and 12 weeks. It's best to call when you get your positive pregnancy test so you can get your appointment scheduled in advance. This is especially true if you're looking to have your care provided for you by a midwife because they do fill up quickly. You can expect a blood test, a physical exam, and questions about your medical history. They'll want to know the first day of your last period so they can determine your due date. So make sure you have that written down. I don't know if they've asked me that. I'm like, wait, let me think about it. So just know that information in advance. They're going to ask about any gynecological conditions, previous pregnancies, medications. They're going to ask about your lifestyle and your family history. They're going to draw your blood, check your blood type, and rule out any other conditions that might need to be monitored or treated. Now, this first appointment is really going to show you the difference between an OB and a midwife. If you have an OB, you'll be in and out pretty quickly, like I talked about before, whereas a midwife, you can expect your appointments are going to take much longer as they want to get to know you, your family, and they're going to provide a much more personalized experience than that OB will. So once you're actually in labor and go to the hospital, assuming you're birthing there rather than at home, you'll have your nurse in your room with you consistently or in and out. It can really depend on your hospital and their policies. They're typically there to mostly do charting, help with position changes, monitor baby. They're going to administer medications if you need them, check baby's heart rate and things like that. So you can expect that professional might be in your room as well. Another person that you might want to consider having in your labor room who I haven't talked about yet is a doula. Labor and delivery doula doesn't have formal obstetric training, but it's quite possible that they went through some sort of doula training and got certified, but a certification isn't a requirement for them. A doula's job is to provide physical, emotional, and educational support to you. Studies actually show that when a woman has continuous support from someone who isn't in their own network, in other words, someone who isn't a spouse, mom and baby have better birthing outcomes. Research shows that if you have a doula, you are less likely to need Pitocin, less likely to have a cesarean birth, less likely to even need pain medication, and are more likely to rate your childbirth experience positively. So let's talk a little bit about what a doula can do, because I think it's pretty cool. Physically, they can give you position ideas for comfort. So maybe you want to squat, maybe you want to stand, maybe you want to sit, maybe you feel like laying in the bed on your back. Not necessarily the best position to help baby descend, but it is an option as well. And they can help you figure out what position is most comfortable for you. They can use comforting touches like counter pressure, and they can use their hands to help a malpositioned baby to get into the correct position for birth, which is super cool. Emotionally and mentally, it can look like someone helping you to have a third party on the outside looking in for the decision-making aspect of things, because sometimes, when you're in rip-roaring labor, it can be really hard to make an informed, empowered decision, and they can help you with that. A doula can also help with your environment. So maybe you want it dark and quiet, which is very typical when you're in labor. That's what moms usually want. That's going to help with the birthing hormones. So they want that hospital room to be dark and quiet, and a doula can help you get to that point. A good doula can also help your partner help you. They have lots of experiences in births, whereas your partner doesn't. So your partner might feel lost and unsure of what to do. Your doula can help guide them to be the best support person they can for you. They can also help you by connecting you with evidence-based resources to help you make informed decisions about your pregnancy and birth. And they can also educate you on what to expect during delivery as well. So they're a super great resource. Oh, and doulas can come to any type of birth, whether it's a home birth or a hospital birth, as long as you invite them along. So now let's talk about postpartum. There's going to be providers that you're going to run into postpartum as well. Whether you're breastfeeding or not, you will likely talk to a lactation consultant. This is a nurse who specializes in breastfeeding. If you decide not to breastfeed, she'll guide you in how to dry up your milk supply. If you have decided to breastfeed, she's a great resource in helping you learn how to latch baby successfully, to make sure baby's getting enough to eat, and to make sure that you're not in any pain when you're nursing. If your baby does drop weight after birth, which they do, that's totally normal. But if they drop too much, she can help you make sure that baby's weight goes back up in an appropriate amount. She can also help with pumping if you need to pump while you're at the hospital for any reason at all. And she can even provide you with a hospital grade pump or a manual pump if you need one. Great resource. Highly recommend, if you have any questions about breastfeeding, to reach out to your lactation consultant. In our area, we actually have a lactation consultant in our hospital that we can visit after birth as well, and that doesn't cost. So that's pretty cool too. Good to know. At least in our area. It might be different where you are, so just check. After you go home, excuse me, after you go from the hospital, you're going to be scheduled for a few different postpartum visits depending on which care provider you went with. If you went with an OB, you'll likely be back at the office at 2 weeks postpartum, and then once again at 6 to 8 weeks postpartum. If you saw a midwife, she may actually come to your home and check on you and baby on days 1, 3, and 7. Then she's going to encourage you to come in for baby's big first outing at around 2 weeks postpartum, and then again somewhere between 6 and 8 weeks postpartum. During a postpartum visit, they'll likely check your weight, blood pressure, do a physical exam, and also a mental health screening. It's super important to pay attention to your mental health postpartum. Adding a baby into your life is a huge life event. Don't be afraid to talk to your doctor if you're feeling down after birth. Sometimes it's normal. It can be called the baby blues, but sometimes it can be called postpartum depression as well. There's no shame in asking for help if you need it. A happy mom means a happy baby. So always reach out to someone if you need it. It doesn't even necessarily have to be your doctor. It could be a friend, a trusted relative, a loved one, anyone. Reach out to somebody. Don't be afraid to seek help if you need it. Another thing you can do is hire a postpartum doula. We're coming right back around to doulas. So doulas can help you during this time period as well. They can help with breastfeeding. They can help with light housekeeping, running errands, meal prep, sibling care, and more, depending on what you've decided to hire them for. And I think that's about it. These are some of the key providers you're going to run into if you have a low-risk delivery. If you found this episode to be helpful, please share it with another mama who might find it helpful as well. If you're enjoying this podcast, please leave a rating and reach out if there's anything specific you're hoping to hear. And as always, if you want to share your birth story on the podcast, send an email to me at thejourneytomotherhoodpod@gmail.com. Thanks for listening.